A male newborn, born at 39 weeks gestation, is evaluated in the labor and delivery unit 2 hours after birth. Prenatal care was limited due to infrequent follow-up, and there were no complications during the delivery. Apgar scores were 7 and 9 at first and fifth minutes, respectively. Weight is 2.47 kg and vital signs are normal. Physical examination shows up slanting palpebral fissures, transverse palmar creasing, and widening of the space between the first and second toes. The parents share that they are glad the delivery went well. The question is, which of the following is the most appropriate statement by the physician at this time? Your options are A. Although your son is healthy and doing well, he may have a chromosomal disorder. B. I have some news that may be unexpected. Would it be okay to share that with you now? C. This may be difficult to hear, but it looks like your son may have Down syndrome. D. Unfortunately, your son may have Down syndrome. I'd like to do some blood work to confirm. E. Your son has some concerning examination findings. Did you have any prenatal testing done? Type your answer in the comment box. Congratulations if your answer is B, which is I have some news that may be unexpected. Would it be okay to share that with you now? Communicating the news of a suspected diagnosis of Down syndrome at the time of delivery requires an empathic approach that is responsive to the parent's emotional needs and avoids negative bias about the diagnosis. Parents should be informed of the diagnosis as soon as possible in a private setting that allows them time to process the news, express their emotions, and ask any questions they may have. Initiating the discussion with statements that frame the diagnosis negatively like, "I am sorry. I have bad news," should be avoided because they convey implicit bias that the intellectual disability associated with Down syndrome is devastating, which may not reflect the parent's values or views about their child. A shift from breaking bad news to sharing unexpected news can help prepare the parents to receive the information without imposing negative value judgments. Detailed information about the diagnosis should be tailored to the parent's knowledge base and how much they want to know at this point in time. The physician should provide information about local resources and support groups and make a plan for follow-up discussion. If you chose any option other than B, you were incorrect. Let's briefly discuss the other options. Choice A cannot be the answer because this statement uses medical jargon to deliver life-changing news without warning. Parents should be prepared that unexpected news is coming, and the physician should use language that is easily understood. Both choices C and D are wrong as these statements are not neutral and frame the diagnosis negatively. Initiating a discussion with unexpected rather than bad news is preferable. Choice E is incorrect because sharing alarming news that the baby's examination is abnormal and inquiring if prenatal testing was done is insensitive and may be perceived as judgmental. When characteristic dysmorphic features of Down syndrome are present, it is better to share the findings, explain the diagnosis, and answer any questions the parents may have. If you're finding this difficult to understand, consider watching this episode again.